Hello and welcome to the Passion Driven Pioneers interview series. I'm your host, John Channon, and today I'm joined by Michael Elsbernd, who is the co-founder of Hinkley Medical. Michael, thank you so much for joining us today.
Yeah, thanks for having me. Looking forward to it.
Yeah, so would you like to kick us off with a brief background as to who you are, what you do, and the business that you're in?
Awesome. I'm Mike Elsbernd, co-founder here at Hinkley Medical. Um, my background is in mechanical engineering, so went to school at University of Nebraska. Came out of school, went to work at 3M as a mechanical design engineer, working on the machines that build the products that 3M makes. And then I was approached by my business partners today, a set of brothers, Tristan and Colton, and they were working on this business. They had an MVP product, kind of inspired by the weight estimation challenges that their paramedic brother faced, so the third brother. And they had developed the first ever patient scale for ambulance gurneys. When I was reached out to join the team, it was for sure an MVP product, but we had set a timeline for going to market. And so now here we are today, just about 3 years since I joined the team, and we've been selling product for about 12 months now. And before that was a lot of R&D, trial and error, really figuring things out.
So you used the term MVP product a couple times. Can you share with us what that stands for?
Yeah, absolutely. So minimum viable product, common term used in the startup world, where they had an idea, and all three of us founders are engineers actually. So being technical founders, we didn't have to outsource the engineering behind it. But like I said, they had this minimum viable product, and we really just needed to test it. We needed to get it into the field. And so that was a big part of my job at the beginning, and continues to be, is on the business development side. So as a mechanical engineer, a lot of people think I'd be involved in the engineering side. It's actually the opposite. I'm very little involved in that side, and I'm lucky enough to work with some brilliant engineers who've developed this product. But we got it in the field then in 2022. We did about 15 trials that year. And then, like I said, we've been actively generating revenue since April of last year, 2023.
Wow, that's impressive. So you were in a fairly secure position within a fairly large company. What was that spark for you that led you to want to jump out of that and become an entrepreneur?
Great question. So, yeah, growing up, I knew I wanted to start a business or be a part of um, a startup or something like that. I quickly found out that corporate world was not for me. Um, this opportunity was unexpected, and I think unexpected because I was so early in my career. I'd only been in the workforce for 11 months when I decided to leave this, like you said, secure full-time job. But joining a company in its early infancy, um, develop a go-to-market, utilize that engineering background, all these things that you can contribute to a growing startup was what excited me. And having, again, a team to do it with was also a big piece of that. So, I had a prior relationship with, our CEO, Tristan. We went to school together. So all of that excited me and kind of filled this inevitable part of what I wanted in life and my career. Again, a little bit earlier than I expected in my career, though.
So saying that this was earlier in your career, did you carry in any kind of misconceptions, or was there anything that you thought was going to happen as you were building up a business that didn't or were entirely different than you originally thought?
Yeah, I think that there's an entire list of those things. One thing easily to address is we really thought we were going to be generating revenue in 2022 when we launched the product, and we didn't start generating revenue until 14 months after we thought we were going to. And that was for a number of reasons. I think lack of knowledge of the EMS industry was a big
Mm.
one. Long sales cycles, that was a big part of it. But moving past that point, uh, you really have to anticipate problems of the future, but not get too caught up on them until they're real problems of today. So I think early on, we were probably focused a little too much on problems that weren't quite hitting our desk yet, when really we just needed to focus on getting in front of customers, generating revenue, those kind of things. So there's so many things that you want to get done in an early stage of a company, but there's only so much time. So prioritization is so important. That's one thing I learned early on. And then time management, of course, is a big piece of running a business, and you don't really understand what that means until you're doing it. So I think between those kind of points, those are the big things that stand out to that question.
Great. So you talked a little bit about time management, and you're in the first couple of years really of a startup. Well,
Mhm.
what's your work-life balance like right now?
Yeah, so this is definitely my passion. Takes quite a bit of time out of my life. I truly believe that if you're passionate about what you're doing, um, then that kind of uh, balance is inevitable. You still have to be surrounded by people that support you in that. So my family, my fiance, um, all very supportive of the business, and I think that's a big piece of it. But one of the things that kind of hit me as I left the corporate world and joined this, something that I'm really passionate about, is again, if you're passionate, or maybe better said, if you're not passionate about what you're doing, then you're probably in the wrong career. You're probably in the wrong company or something else, and only you can figure that out. There's not really a book to write that for you. Um, but I think that the balance between work and life really finds itself when you're passionate about what you're doing.
Are there any either rituals or habits that you might use that keep you motivated and focused? You know, you mentioned your passion as being one of the key things,
hmm
right? But any other habits in that regard?
That's a great question. I would probably turn to just the fact that our team's very process driven. So when we think through the problems that we have, being technical founders allows us to have this um, process driven approach to everything. So we really take pride in knowing we don't have the answer, but developing a plan to get to the outcome that we're trying to achieve. So planning and process, just thinking through the problems is a big piece of that.
So you guys have come forward with a fairly innovative solution here to what was essentially, I think I saw on your website, a bit of a carnival game.
hmm
But in the changing business landscape, how do you guys stay adaptable and open to change?
Yeah. So reiterating, I guess one thing I just said is we take pride on knowing that we don't have the answer to everything.
Mm.
It's been a core value of ours since starting the company and growing it, to really seek out the people who've been there. And then we can filter that down. We do get a lot of advice, and being able to filter it down is really important. Experiences from a big med tech company with 50,000 employees, there's probably some pieces of that that are really helpful, but there's also some pieces of that that aren't going to apply to a company like ours. So um, that's one thing that we do to kind of stay adaptable. The other is we're very innovative. We're constantly kind of thinking through ways to improve and make these processes that we're building repeatable, whether that's a tool, technology, people. It really has to be repeatable to scale. So we try to develop those strategies in order to do that.
Okay, good. So staying maybe on the future looking path here, could you offer a glimpse into the future plans that you guys have and the goals for your business?
Yeah. So our goal is to impact EMS, emergency medical services, like never before. We've always stayed true to our mission to reduce pre-hospital medical errors and enable clinicians to provide safer and more efficient patient care. So when we look at the disruption that we're causing in the industry, and it's very apparent when we go to these trade shows, it's right in front of us. We can see the impact we're making. It really fuels us to keep pushing the needle. But we're just starting. So the scale that we have, the software that we've developed to pair with that patient scale and give paramedics dosing information, treatment references, and such is just the beginning. There's a streamline of communication that really needs to be addressed in this industry. Communication from dispatch, that 911 call that goes to a dispatcher, all the way to the hospital. So there's a lot of communication barriers that we feel we can impact being a point of care solution. So that's just a little glimpse into kind of what the future plans of the business are.
Yeah, and a lot of what you're dealing with out there is obviously very serious situations. Does that weigh on you guys at all as you're kind of thinking about the future?
Yeah, having gone through a couple of pivots, one being the fact that we are now a SaaS company. We started as a medical device company. We're just we're taking what the customers are saying and applying that to our business. So this goes back to one thing we talked about earlier in the adaptability. You have to be adaptable in a startup. And so our change to be a SaaS company with a hardware component has really driven the growth. And we try to stay on top of what our customers are asking for and really find the best way to address that within our solution.
And would you mind offering just some insights into that what prompted that transition, right? You mentioned going from a product company to the software as a solution company.
Yeah, great question. It really can be pinpointed down to one day in August of 2022. We had our advisory board meeting, and we had some potential customers on our advisory board, and one of them brought up, guys, the scale is step one. We need the accurate weight to treat our patients, but we're still doing mental calculations. We're referencing paper handbooks. We need a tool to take that weight and make it easily understood and quickly understood by the provider, so that we can address the patient's needs. So we had the idea of going to a dosing calculator software at some point, but that meeting in August of 22 was really the kick to say, hey, this needs to happen. This is a big part of what we're doing. And now over the last year and a half since that, we're finding that that's really driving the growth of the business.
Wow, that's really cool that you can actually pinpoint the date and reference the discussion that caused that change and shift in attitude.
Yeah.
So, kind of looking forward for you guys down the road, 5 years from now, any particular visions or plans or expectations you have for your company that you'd like to share?
That's a great question. So again, it's all surrounded around our mission to enable clinicians, EMS clinicians, to provide safer, more efficient patient care. We have so many ideas. It's just not enough time in the day, right? So looking 5 years down the road, we hope to be have a number of products. Right now we've got 2. We had 1 a year and a half ago. We're up to 2. We see so many different areas, hardware and software, that we can impact the industry, in particularly around reducing medical errors. So these errors come from cognitive load, they come from the weight estimation, they come from miscommunication. So being a communication platform is a big piece of where we're headed. And then again, that intertwine or communication between different systems. We want to be open to partnerships with other companies in the industry and not shut down and say, no, you have to be a Hinkley product or you can't integrate. So being integrated with the EHRs is a big piece of it. Those electronic health records, or EPCRs in EMS, patient care records. That's huge and part of the roadmap. And then integrating with other hardware devices like cardiac monitors and different devices like that as well.
So let me ask you another question. COVID had an impact on a lot of different businesses, and in particular, first responders. Did COVID have much of an impact on what you guys were doing during the time that you were kind of getting this up and getting it going?
It really didn't on the business side, at least when I got involved. Tristan may have a comment about that from 2020, but we really didn't get going until 2021, 2022. And there wasn't an immediate impact on our business that I'd be able to point out.
Okay, good. All right, so recognizing that this show is really targeted towards, people who are either thinking about starting a new business, in the process of starting one, or in their first couple of years, do you have any final thoughts or aspects that you want to make sure that you're able to share with them?
Yeah. The first thing that comes to mind is team. So, I've talked about us three technical founders, but we all have different things that complement each other. So when you look at our team, you see, our CTO, Colton, he drives that software side of things. He's a computer engineer. Tristan, great CEO. He's a visionary, thinking about the future of the company, but also a brilliant engineer on the hardware side, so mechanically sound. And then for me, I'd never say I'm the best engineer out there, but I do take pride in being able to build relationships, and on the business development side, that's kind of where my strengths lie. So the fact that all of our strengths kind of complement each other is huge. And I'd say for anyone out there starting a business, you're not going to be able to do it alone. At some point, you will have to bring a team in to help you. So think of people that are smarter than you and better than you in different areas and can complement your skill sets. The second piece of that, don't give up. We've failed so many times, and we're going to continue to fail fast, and fail with positivity and optimism that the best is yet to come. So those are the couple pieces of advice that I would leave.
Those are really pretty good. Thank you. So, listen, I want to say thank you so much for your time today, Michael. It was great meeting you and learning more about your entrepreneurial journey, and learning more about Hinkley Medical, which is a fantastic story.
Thanks, John. Appreciate your time.
And for everybody watching, I look forward to seeing you at our next episode.